السلام عليكم ورحمة الله وبركاته، وأسعد الله جميع أوقاتكم بكل خير. بسم الله الرحمن الرحيم، الحمد لله والصلاة والسلام على رسول الله. سنبدأ اليوم سلسلة محاضرات لطب الأطفال لطلبة كلية الطب الجامعة الإسلامية، ونبدأ بمحاضرة مهمة جدا جدا لمساق طب الأطفال في السنة الخامسة، وهذه المحاضرة غالبا نعطيها في بداية الكورس لمساعدة الطلبة في أخذ تاريخ المرض وفحص الطفل. سنركز في هذه المحاضرة على تاريخ المرض، ثم ستكون هناك تفصيلات لفحص الطفل عن طريق إرسال بعض الفيديوز للطلبة ليتفقدوها ويتبعوها في فحص الأطفال. سنتحدث اليوم في هذه المحاضرة باللغة الإنجليزية، وبناء على طلب الطلبة إذا أرادوا في المحاضرات القادمة أن نشرح باللغة العربية فسيتم ذلك. في بداية هذه المحاضرة سنتكلم عن الobjectives. The objectives for this lecture, by the end of this lecture, each student will know the difference between taking the history for the child or for the adult patient. Again, every student will know how to take the history, how to do physical examination, how to write the investigations and management plan, and he will plot and write all these things in the admission sheet. We will start by the difference between a child and adult history. When you take the history from the mother to the child, so the mother is a third party. But for the adult, you will take the history from the adult directly. And the watcher who is admitted with the patient in the hospital sometimes will be the mother who is living and carrying and take care all of the time with the baby 24 hours. And sometimes the watcher will be the sister, the grandmother, even sometimes the neighbor. So it is different from whom you have taken the history. The second point, when we will take the personal history, we take the age of the child, but it is important to take the date of birth, because this one will help us to calculate the correct age, which will help us again in plotting the growth parameters in the growth chart and to evaluate accurately the growth development. Again, it is not logic when you will take the adult history is to ask the adult patient about when his mother was pregnant with him and how his delivery was, crying immediately after birth. But of course in children it is very important, because we have many problems related to the health of the baby, maybe congenital infections, perinatal asphyxia, and so on. Again, nutritional history is important for children because of the rapid growth. Developmental history, also there is rapid development, that's why developmental history is important. That is not logic, of course, to take it for the adult. And again, we have to take the vaccination history against the pediatric infectious disease. There is some difference in the family history regarding, speaking about consanguinity or some inborn errors of metabolism and some genetic diseases. So the component of the history for children, there are 10 components: the personal history, the complaint, history of present illness, past medical history, perinatal history, nutritional history, developmental history, vaccination history, family history, and social history. Regarding how to take the history from the start, how we will take the history from the mother. So first of all, you will by whom the history was taken and from whom. By whom, for example, you are medical students. You will say, I am Muhammad Ahmed, for example, a 5th year medical student. I have taken the history from the mother or grandmother and so on, who is cooperative and informative, or incooperative and not informative. This is according to the situation. Even sometimes the mother herself may not be cooperative. For instance, if the child is admitted with febrile convulsion, and usually the mother will feel that her baby will die that time, she will not be happy to give you the history. So you will take a brief history in the beginning, and you have to go again to the mother in the afternoon to take the full history from the mother, because she will not be informative at this point. You have to introduce yourself and take permission from the mother. You will say to the mother, I am Muhammad Ahmed, 5th year medical student. Please, I want to take some history from you about the illness of your baby. This is taking permission, of course. And you will ask her whether the situation is okay for her, or you have to come to her another time to take the history. You will wash your hands and you will secure privacy. You will secure privacy. Of course, sometimes in the OSCE stations, because in the OSCE stations usually we assess the attitude of the student, the communication skills. Don't say to me, I will wash my hands and secure privacy. Okay, you wash your hands, or you rub your hands with alcohol, with a gel, for example, and just you slide the curtain to secure privacy for the mother. We will start the history by taking the personal history. As you know, the personal history contains the name, the age, and we mentioned that date of birth is important, the sex, and the address. Every part of this personal history is important. To speak in detail, sometimes the name or the family name for this child, we know that this family, for example, they have some of the inborn error of metabolism, or they have some genetic diseases, and this is usually it is running in families, so we will benefit from that. Again, the age, we have different infectious diseases. It is according to the age, and even some other diseases, this disease is depending on the age group. Some diseases also related to the sex. Some are running in the families. Some, and for example, autosomal dominant, and some sex-linked recessive, for example, diseases that occur in boys, not in girls. The address is important again. The address is important for many things. If this child, they are living far from the hospital, it's different than if they are living beside the hospital. Sometimes if the baby in the emergency room, for example, he has bronchial asthma, and we have given him some ventilator nebulization, and I am hesitating to admit him or not, and the mother, he has, for example, some situation that she cannot be admitted with the child and she has to go home. If they are living beside the hospital, no problem. I will assist the patient and will ask her to come, for example, anytime if the baby has any problem, or to come for taking the ventilator nebulization. Again, if you will decide to discharge the patient, sometimes the patient is far from the hospital and they have no medical services, or the medical services are far from there. So if he has this disease, I will decide to admit the patient. Again, if I want to discharge the patient and he is living far, then I will be hesitating to send him. But if he is beside the hospital, I can send him home and he will come out on pass for the treatment and so on. Regarding the complaint, we prefer when you will write the complaint in the child history is to write the symptom and its duration. For example, fever for 5 days, runny nose for 4 days, cough for 3 days, and shortness of breath for 1 day. This sequence of symptoms will help us when we will write the history of present illness. There is another option to write the chief complaint. The chief complaint with the complaint which is important, and it is the cause of the child admission to the hospital, which is, for example, in this situation, it is shortness of breath. So either to write the complaint, and we prefer that in sequence method, fever 5 days, runny nose 4 days, cough 3 days, shortness of breath for 1 day. The second option is to write the chief complaint, and then during taking the history of present illness, you will speak about the other complaints. The history of present illness. Usually we have how to start writing or speaking about the history of present illness. Your start will be depending whether the child is healthy or he has a chronic disease. For example, we gave example for a healthy child. There is a child who is healthy, he has no admissions before, he is growing well and everything, and he has this illness. So in this child, we will say, for example, about the previous example, we will say 5 days back, this child was perfectly well. 5 days back, he was perfectly well when he started to have fever, and we start to speak the history of present illness. But if we have a child with a chronic disease, usually some of children with their chronic disease, they will never become very healthy, but they have usually exacerbation of the symptoms, and sometimes symptoms are less. That's why children with the chronic illness, if the chronic illness is diagnosed, we will say this child, known case, for example, bronchial asthma, type 1 diabetes, nephrotic syndrome, or some genetic diseases like this. We will speak he is known case of so and so, and he was, instead of speaking that he was perfectly well, we will speak he was in his usual condition of health, or he was apparently well when he started to have fever, runny nose, and so on. So the start of the history of present illness will depend whether the child originally was healthy or he has a chronic disease. Then we will start to speak about the symptoms, to take in details, to dig for the symptoms, to do comprehensive analysis for each symptom. We will cover the symptoms of the same system first, and then we will go to other system. But of course, in the previous courses you have taken that when you will speak about symptom, every symptom has different questions. For example, regarding the fever, you will speak about the fever, whether it is high grade, low grade, documented or not, relieving factor, aggravating factors, diurnal variations, and so on. If you will speak, for example, about cough, you will speak whether it is a dry cough or productive cough, and if the severity of the cough, of course, is important. If the cough is awakening the baby from sleep, this is considered severe cough. If it interferes with his nutrition and breastfeeding or feeding, for example, this is also important and severe cough. We will speak about cough, whether it is dry or productive, and if that cough is productive, we have to speak about the sputum, the amount, the color, the odor, the content, and so on. So each symptom we will speak about details related to that symptom, and we will speak about that in details. Again, if the family, for example, they sought medical advice in some primary health care or Anwar clinics, and they have taken some medications, we will speak about the medication, and usually you mention the pharmacological name of the medicine and how frequent it is taken and what is the dose, to be sure exactly whether improving the child, improving or deteriorating while taking these medication. So we have to speak about the symptoms related to this system. In our example, this is related to respiratory system: the fever, runny nose, sneezing, cough, shortness of breath. Then, for example, we'll speak about shortness of breath, which degree of shortness of breath or difficulty in breathing, and whether it is associated with tachypnea, chest recessions, flaring early, nasal, grunting, cyanosis. All these things we will speak about them in details regarding this. After we will finish the symptoms, written symptoms, and the symptoms related to the same system, then we will make a review for the other systems. We will start by general, for example, the heart, the GIT, the urogenital system, and so on. So we review of other system. And again, if this is the presentation is infection, as in our example, this one, so we will speak about I'll ask about the history of contact to other siblings or other person with the same illness, and this is important, either at home or in the kindergarten or in the school, and so on. As regards to the past medical history, as you see, it has many components in children. If he is known, for example, case of bronchial asthma, we'll speak about when it was diagnosed, what investigation were done for him, and what is his management plan, and what medication he is taking, with the doses of the medication, whether improving or not. And again, for example, if he has infection before, what medication, antibiotics, and whether there is improvement for this one or not. So we will speak about summary of the disease, of the chronic illness, whether it is, for example, like cerebral palsy, when it was diagnosed, what investigation were not, because if there is deficiency in the investigation, we need more investigation, we'll do that. And what was the management plan, and what will be the cause of this admission at this time. Sometimes, for example, type 1 diabetes, he is on insulin, he did not take the dose, or there is a wrong calculation of the dose, or like this, or about the eating, he has taken the insulin but he did not take his breakfast or something like that. We will know all these things. We will speak about past history of similar attack. We will speak about past history of similar attacks, and this is important because, for instance, if the child frequently has infections and failure to thrive, we may suspect another cause, like, for example, immune deficiency. Sometimes because of malnutrition or undernutrition, there is secondary immune deficiency, so we have to treat the original problem. Again, if the child is coming many times with bronchopneumonia, then we may suspect foreign body like this, which will be the cause of this frequent admission, and we have to remove the original problem, which is the foreign body, to remove it, and this will cure the child instead of coming and going every now and then to the hospital. We will speak about previous admissions, the frequency of the admission. For example, if he is a school child and he has, there is a lot of admissions for him, he will miss his school, and this is, of course, this is a problem for him, and there is some social problems about that. So we have to speak about admissions, previous admissions, what medication were taken. Maybe he is not improving this medication. We have to especially in chronic diseases, to change the medication or change the dose and so on. They will speak about past history of surgery. If you will not take the history of surgery, For example, and the child, he had tonsillectomy 1 year back, and then you told the mother that he has tonsillitis. This is a problem, of course. She will tell you, doctor, but he removed the tonsils 1 year back. So be correct, be accurate, even in your pronunciation. Not every throat congestion or pharyngitis it is called tonsillitis. Be accurate for when you speak to the mother, not to put you in trouble or in a problem of wrong diagnosis. Again, history of blood transfusion, if also there was reaction or anaphylaxis or something like that. We will speak about history of drug and food allergy. If there is allergy to drugs, it is a problem. If you give the child this medication another time and he will have anaphylaxis, for example. If he has food allergy, also don't advise to give this food to the child. Again, in case of chronic illness, it will be good to speak about drug history, what medication continuously given to the child and whether he is controlled or not. Then after the past medical history, we speak about perinatal history. We speak about history during pregnancy, the perinatal period, the natal history and postnatal. And you know, of course, what to ask about pregnancy. For example, if you rule out some congenital infection, whether the mother was sick or she has some rash during pregnancy, she has many infections, or she is exposed to X-ray, she has taken some medications, or to trauma or something like that, we have to take all these things in details. And even, when we take OB-GYN will speak about the movement, quickening of the child, and whether he has frequent movement or he is lazy, is infrequent quickening. All of these things will help you. For example, you have a child, you will diagnose him as spinal muscular atrophy, Werning-Hoffman disease, like this. Usually, when you take the history during pregnancy, the mother will tell you, I was not feeling with his movement in the abdomen like other children. And the problem will start during a pregnancy. So it's important to take the history during pregnancy and the prenatal history, and regarding the delivery, whether he is full term, preterm, the mode of delivery, normal versus delivery. We'll speak about Apgar score, cried immediately after birth, the child or not. And again, the early postnatal period, if there was a problem, respiratory distress, for example, there was perinatal asphyxia, and the baby needs resuscitation, admission to NICU, and for how long, and whether he had intubation, and for how long he was intubated, to know the severity of his condition and whether it is affecting his health or not. If he has jaundice, for example, or pallor or some other points. So if he is normal pregnancy is uneventful, was born normal versus delivery with full term, his birth weight 3 kg, cried immediately after birth, there is no admission to the hospital or to NICU, there was no postnatal, neither jaundice or pallor or any problem, and he started to feed well from the first day. So perinatal history also is important. Nutritional history. The first thing needed by the baby when he is delivered is nutrition and breastfeeding, for example. That's why we advise the mother to put him immediately on her breast to start breastfeeding. This nutritional history, sometimes we take it briefly. Like example, or in older children, it is and you find the school a child who is healthy. No need to write in details about the perinatal history, nutritional history. For example, perinatal history, we can say usually in the 5th year we ask them to write all these details. But by the time when in the 6th year, when they become in the 6th year, usually they will write the history brief, and they will have the skill of summarizing the history. So in that time, perinatal history will say he was uneventful, apart of some so and so. Nutritional history, it was okay, and he is sharing family food, for example, and so on. So these points, it according to the age and the condition of the child. For example, child is coming to complain about pallor. The mother is complaining or about pallor or bow legs or rickets like this. So I have to, or he has failure to thrive. While you are taking the history, you look at the baby and you see that the baby is small for his age. So nutritional history, this one should be taken in details and thoroughly, especially if the child is infant and the first year of life. Because if there is a nutritional problem for the child and we corrected early, it was correctable and we corrected early, then the child will grow well and he will follow his peers in the growth chart. But if the child is, for example, having a nutritional problem, and he will have failure to thrive and he will have permanent problem, this is, of course, this is wrong to take a brief nutritional history. Nutritional history for infants, for example, we speak about breastfeeding, whether it is exclusive breastfeeding or not, because the WHO recommendation is for the baby is to have exclusive breastfeeding for 6 months. We have to mention that exclusive for how long, and this is important if we will make research or audit about the percentage of Palestinian mothers who are giving exclusive breastfeeding for their babies. So it's important to speak about exclusive breastfeeding or not. Again, if they will start formula and the type of the formula, and even sometimes the amount of milk given and the frequency of feeds, especially if the child has failure to thrive. Then we will speak about proper weaning when they will start semisolids, gradual starting of semisolids for the child, and what type of food is given, especially if the child looks with a nutritional problem. If he has failure to thrive or a nutritional disease, we will speak in details about the nutrition of the child. Even sometimes we will calculate in cases of formula what is the amount of milk during the feed and how many feeds. So we will calculate the daily calories and the daily fluids given to the child, and we will see if there is deficiency there. Then we will increase the feeding and increase the calories by any way for the child to avoid failure to thrive. But in all the children, of course, sometimes if he looks a child appropriate for his age, the growth is appropriate for his age, only we'll speak that he is sharing family food. Sometimes we will speak about appetite and the food types of the child. Developmental history, sometimes it depends on the nutrition. That's why we start in nutritional history before the developmental history. And developmental history, especially in infancy and the preschool, it is important to speak about it in details. And you have to know the developmental skills of the child and the growth, all the growth and development for the different age of the child, and to compare that with this child. You will take the developmental history regarding the gross motor. For example, the baby when he started sitting, standing, walking, for example, jumping, and so on. We speak about fine motor starting, for example, in reaching for the object and transfer the object from one hand to another, and to speak about this pencil grip and so on. We will speak about social history, starting by the social smile at the age of 2 months. Then we will speak about speech whether the child when starting, to speak one word with meaning or 3 words of meaning, or how many words he can speak, and whether he is joining words together or not, and he is calling his children by names and so on. We will also, in the developmental history, whether the baby is hearing well or not, because if he has hearing problem, we have to interfere early for him, so to avoid that he to become deaf and mute. And again, we will assist, we will ask about the vision, whether he is seeing the mother or not, and he is looking at her while she is giving breast feeding, he is looking to the surrounding like this, and so on. So we will have developmental history regarding all these things. The importance of the developmental history, to know the developmental age and to compare it with the chronological age. For example, some children, they are 3 years old, but the developmental age is 1 year only. He is 3 years, but only he is, for example, started to walk with one hand held, or he started to say Papa and Mama with meaning, and so on. So his, his developmental age is only 1 year, while his chronological age is 3 years. That's why it's important to take this one during taking, and to keep it in mind in taking the developmental history. But this developmental history, it is unlogic if you have a child who is in the school at 6th class, he is number 1, his grades are very high. So to ask the mother when he started the social smile, he started to recognize the mother, starting, to sitting, standing, walking, started to say Papa, Mama. This is unlogic for older children. That's why the developmental history is important for the children, older children, to speak about the grade in the school or the kindergarten and the performance. Be sure that you have taken the grade, because maybe the child sometimes he will fail 1 or 2 years, and we speak he has good performance, but he is repeating the years, and he failed in 1 or 2 years. That's why we want to know that the grade is corresponding to his age, and he has excellent or good or very good performance in the school. It is most important to take the vaccination history. That's why we give you a separate lecture about vaccination. And every student, usually, when he starts the clinical period, we will give him things he has to keep it in their pocket. One of them, the vaccination schedule. He should know the vaccination schedule, the National Palestinian Vaccination Schedule, and we will see the history whether the child is following this schedule or not. And again, the same, growth parameters, and this the tape measure and hammer and stethoscope and all these instruments should be available with the student. Even advise them to put small bottle of hygiene in his pocket, to rub his hands with alcohol gel before examining the patient. This is a very good thing if all the students will do that thing. We will ask the vaccination whether is it completed, but it is not good only to say that he is following that child, he is up to date or completed the vaccination. That's why the second thing he has to mention is the last vaccine. It is completed. Who knows that what is completed? If the child, for example, has a chronic disease and he has frequent admission to the hospital, usually if the patient is sick, they will postpone or they will defer the vaccination that time. So we have to know whether he is regular for the vaccine, about knowing the last dose given to the vaccine, or he is defaulter and he missed 1 or 2 vaccines. We will ask why he is defaulter, whether there is a problem with the child, or he was diseased, or so on. It is very important to ask the mother to bring the child health book and to look for the vaccinations in this child. card. Again, you put the growth charts in this card because it will be there, or you take the growth parameters will be written. Instead of will take one time plot the growth parameters in the chart, the growth chart, you can put serials of parameters, and we will know the growth velocity of the child whether it is good or not. That's why it's important, it is good to tell the mother about the importance of this book, and that she has to carry it in her pocket, and she in any place she will go to treat the patient, she should keep it in her pocket, and she has to show it to the doctors. Many important informations, for example, maybe there is either not only growth and development. Sometimes the child, he has, for example, some diseases like glucose 6-phosphate dehydrogenase disease, and it is written in that book, but you don't know, and you started to give the child medication which is causing hemolysis, for example, for the child. This is problem. That's why it's important to encourage the mothers to bring the child health book, which includes the growth before and the vaccination schedule as well. And if you are following, like the 6-year medical students who are following the patient from the start of admission till the end of admission, and he will write the discharge summary, it's important in the first time, if the mother did not bring the book, to ask her to bring it the second day. This will show her the importance of this book, and should be available with her. Family history for children is very important, especially in infants, and neonates is more essential to speak about the mother, the age, because some mothers old age may have children, for example, the increased percentage of trisomy 21, for example, or some genetic disease. The age of the mother, the education of the mother is important as well, because if you admit a newborn, and he has some problem and he needs proper management at home, or a child newly diagnosed type 1 diabetes, and you will teach the mother how to calculate the insulin and how to give the insulin doses. If the mother is not educated, of course you cannot depend on her, because she may give the medication in an incorrect way, and she will endanger the life of her child. So education is, to ask about education is important. And again, to ask about employment of the mother, because the working mother considered a risk factor for a child. And some of the countries, they will consider, they have a well baby clinic, and if the mother is working, they will put the child in the category of at-risk children clinic, because the mother is, is a working mother, because she is not staying all of the time with a child. That's why he will not have the care like other children. So employment is important, not only for the mother, also for the father. And we speak about this is even sometimes for the social history. Social history also, of course, is important. If, for example, neither the father nor the mother, are working, and they are receiving only some social support, some few money. So you have to know that, because if I will discharge, for example, the child on medication, and the medication is expensive, it is unlogic to write expensive medication for family who are not having income. So these things are important. You will speak about consanguineous marriage, because many of the diseases, they are, for example, they are autosomal recessive disease, and we have a lot in our country, because we are in a close community. Consanguineous marriage is important, whether they are consanguineous or not, and this is important for genetic diseases. One of them is the autosomal recessive. For example, these all diseases most of the diseases of inborn errors of metabolism. We ask about consanguineous marriage, about to be sure whether there is congenital or this is hereditary disease. We will speak about number of sibling boys or girls and whether they are healthy or not in general, but we will ask in the family history of the similar condition. For example, a baby who is coming with chest wheeze and we will diagnose him as bronchial asthma. We will ask about the family history of bronchial asthma or related conditions like allergies, eye allergy, allergic rhinitis, sinusitis, skin allergy, eczema, and all these things are important to ask about them in case of bronchial asthma. And according to the disease, you will ask about the similar conditions. Then, as we do in the adult, this one, the family history of chronic diseases like diabetes, hypertension, and so on. We will ask about genetic diseases because especially those diseases are running in family, congenital, for example, heart disease or something like that. After you take the family history, you will draw the family pedigree. You will draw the family pedigree. You will start, for example, a square for the father and a circle for the mother. You put one line between them if there is consanguinity, but if there is consanguinity, you will put two lines, and you will start from the left side to write the elder child, whether boy or girl, and what is the old, whether diseased or not. Then you follow to write all children according to the age and whether he has the same disease or other diseases or not. And even sometimes in the family pedigree, you will write if there is abortion or stillbirth or early neonatal deaths, or all these things should be written thoroughly, and we will teach you about this, how to write and how to plot the family pedigree. The social history is important to speak something about parents. Sometimes the student will speak to me, they are living in concrete house and they know this as if, register like this. And no pets and something, but they did not speak that the mother is divorced, for example, and she is living only with these children. They have no income, or they are separated. The parents are separated. They have other, or the father sometimes he has 3 other wives. All these things should be included in the social history because it will affect the health of the child. If the mother has home problems like this, psychological problem will not be stable, and this will be reflected on her baby. Speak, of course, about the housing, the type of concrete or not, or tint even in the desert, or number of rooms, the aeration and the sun, especially in cases of wreckage and so on. And again, regarding the equipment or the things available, furniture in the house, if they will have, for example, washing machine or not, a sweeper or something. All these things, we should know about that, because if, for example, they don't have refrigerator and they are coming with signs of food poisoning, for example, and they could not, refrigerate. Again, we will ask about electricity. Especially we have the problem of electricity here. For how long during 24 hours you have electricity, or they have alternative method of for the refrigerator or something like that, because the food may be spoiled and cause food poisoning for the children. So all these things are important to take them during the social history. We will speak about pets, animal pets, if they will have, and this we have, as you know, many zoonotic diseases like brucella, for example, and some rickettsial disease or related to the pets. We have to take the history whether they have pets and whether they have birds or even animals or dogs, or they have goats or sheep or cattle there beside the house. We will, for the child especially coming with bronchial asthma, we will take the history whether the father or mother even is smoking, and this will affect the child too much, and whether this family having medical insurance to be sure that they can get the health services any time. Now we will speak briefly about the admission sheet. Maybe this admission sheet is important for the 6th year more, because we ask the students to fill this sheet and then to take the progress note daily and to write the order sheet for the child and to plot the growth on the growth parameters on the growth chart there, and we ask them to fill the medications and the cardiacs, and even at the end to write the discharge summary or even medical report for the child. All of the 6th year students should be trained on that, because we consider them a shadow of the intern. So in the first day they will start the internship, they should know everything and they will be powerful, and we really we are happy and with our students, when they are, and we follow them after graduation, also what they are doing in the hospital, whether they are perfect or not. So regarding the admission sheet, as you know, this is the picture of the first page. It is available in 2 pages, and the first page consider this histories, and the second page will be containing the physical examination and others. As you see here, the pediatric admission sheet, first of all the personal history, the name, and as we mentioned, there is the date of birth also, it is here, the date of birth. Then here again the age, how in years and so on, sex, male or female, the address, and from whom you have taken the history. All these things we talked about that. The source of the history, whether cooperative or informative or not. This is the complaint, as we mentioned. We speak about the complaint, the symptom and duration only. Then we will start history, present illness, as we mentioned. Usually to start with it, in normal child we will say that he was perfectly well when he started to develop, so and so. And for chronic child we will say whether he has an usual condition of health or we say that he is known case of, for example, type 1 diabetes, and he was well or apparently well when he started to have so and so, and we will speak about symptoms related to the same system in details. Then other symptoms, digging for other symptoms related to the system, then we make review of other systems, and we speak about history of contact to disease patient in cases of infectious disease. This is the past medical history briefly, as we know that we talked about, his condition, chronic problem, and history of the same complaint, admissions, history, blood transfusion, medical or drug history, or allergy or food or drugs and so on. Talk about all these things. This is the perinatal history. Then this is the nutritional history, developmental history, immunization history, family and social history, and this is here we will draw the pedigree. This is the father, this is the mother. If there is consanguinity, we'll draw another line. Then they will start, the elder child will be here, then the other children will be following him there. This is the second page of the pediatric admission sheet, will include the physical examination. As you see, vital signs are vital. That's why we will write here temperature, heart rate, respiratory rate, and blood pressure. The 4 vital signs should be taken, and no excuse really for some of the vital signs to tell I could not take. No, because you yourself, you can take the temperature. Yourself, you can take the pulse or heart rate. The respiratory rate, you will count it, and you are trained for all these things. If there is problem with the blood pressure, you have to mention and to say, I could not take blood pressure because the apparatus, for example, maybe apparatus is out of order or something like that. But you have to mention the 4 vital signs. Then the growth parameters, as we mentioned, the weight, the height or length, and the head circumference, and you plot them in the growth chart. If they are below 5 years, all children below 5 years should be plotted in the Z score. You will see that it is, for example, below 0 Z score, below -2 Z score, below +2 Z score, and so on. And again for weight, length, and head circumference. And we trained already all the children about, all the students about examining the children, how to take the growth parameters for them. And you know, as mostly you will have a clinical skill station in the OSCE about taking the growth parameters and plotting them on the curve and making interpretation for them, and to know the cause, for example, in cases of short stature or some dysmorphic features like Down syndrome or like Edwards syndrome or like Turner syndrome or Noonan syndrome, and so on. So all these things should be accurately written. Sometimes in the beginning we speak about the general look, because if you, for example, you are presenting the case in the morning round, just speaking about the child looks well, it is good. So this is the other things, whatever you will speak about them, it will be no problem, no big problem. But if he looks ill or very ill, so this will draw attention that child may go to admitted to the ICU, pediatric ICU at a time, or may need more, care. Or also, if you will take making handover for you are in duty and another colleague is coming, after you have to mention all these things about our very ill patients, because they may deteriorate anytime and they may need pediatric ICU admission anytime. Then general examination, all of you know all these things, how to examine in different systems, and you are trained, for the examination, and all of these things we are bringing them in the OSCE clinical stations. Head, eye, ENT examination, chest, cardiovascular, abdomen, CNS, and neuromuscular. All of these things should be like this. Sometimes there is another option. Sometimes we start in the examination after the general, we speak about the included system. For example, he is coming with convulsions or a neurological problem. So we'll start in neurological examination or CNS examination, then we will go from head to foot like this one. After these examinations, of course, what investigation will be written for this child regarding, you put in our mind that the differential diagnosis, and according to that, we will write down the investigations needed. Then after that, we will write the provisional diagnosis, we write the disease, and also we ask the 6-year medical students to write the ICD-10, International Classification of Disease, number 10, and this is for hospital admitted children. You respect here the diagnosis, and you will write the ICD-10, either 3-character general disease, for example, meningitis, or 5-character dot another number here if you have, for example, bacterial meningitis, viral meningitis, and so on, as an example. Then you will write all the diagnosis here, and with the ICD-10 numbers. You will write your management plan. Management plan here, you will be, for example, in the beginning, you admit this patient, for example, under care of consultant so and so. And then, for example, nothing NPO, keep the patient NPO, put him in oxygen, and so on. And then we will write the medications will be given, doses of the medication, and so on for the management plan for the patient. Don't forget to write your name as a doctor in the future, in the very near future, all of you will be doctors, and they may treat us in the future or treat their teachers. So you write your name, clear, you sign, and your signature also should be clear to have some relation to your name, and this will protect you. For example, if there is an inquiry about patient who is regarding morbidity or mortality, and you are asked, what you have done, so signature is important. You put your stamp. Also, when you become a doctor in the very near future, you will write the date and time of your examination sheet. Now, of course, if there are any questions for you want to ask me, you have my email. You can send me on the email or in the messenger, or again in the future we will find any way for you to communicate, and maybe in the future we will make some interactive lectures or webinar or something like that, so to allow you to, anyhow, if you have any questions related to that, you can send me to the email or you send to my messenger, and I will be happy to answer any question for you. So by the end of this lecture, every student knows that how to differentiate between child and adult history, how to take the history for children, about physical examination and consequence of the physical examination, the investigations and management plan, and how to fill the admission sheet. Thank you very much.